So hello and welcome to our Get Transition Ready workshop series. My name is Heather Miller. I work with the Diabetes Hope Foundation as the program director there. And this is sort of the third in the series that we've done. We'll be talking today about student health insurance plans on campuses and how to access them, what you can get through them to sort of help you cover the cost of your diabetes supplies and diabetes meds. And we're very excited to have everyone join us today. I'm also joined today by my colleague, Christian, if you wanted to introduce yourself quickly.
Hi, everyone. My name is Christian. I've been working with DHF for a few months now, and I've been supporting Heather with administrative support as well as some other responsibilities and duties. So good to be a part of this and looking forward to meeting all of you.
Awesome, thank you. And then we're joined by four amazing panelists today. We have Ashley, Carol, Nefmi. I've lost my panelists a little bit there. Sorry, three panelists, one of them called in sick, but we'll introduce them just in a couple of minutes. So I just wanted to start with the land acknowledgement. So we're coming to you from Toronto, and Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. And I know we do have people joining us from across the country, so if you'd like to find out more about the territory that you live and the treaties that govern that space and the Indigenous peoples who inhabited it before colonization, you can go to nativeland.ca and do a little bit of research and educate yourself there. Just a quick overview. I know a lot of you are familiar with the programs that we do have at DHF, but a quick overview of the programs that we have. So we have our Hope Connects Peer Mentorship Program, which is for all first and second year university students who are living with diabetes and just need that extra support person in place. Our peer mentors, Nefmi is one of them, one of our star mentors here today. They're there to sort of give you that extra support. They're not there to give you medical advice or counseling, but just someone to vent to when your sugars are out of control, or you can't figure out how to navigate accommodations, or you just need someone to talk to who kind of gets what it's like to go through university living with diabetes. If you're interested in that, you can sign up at our website, diabeteshopefoundation.com, and I'll get in touch with you and we'll match you with a mentor based on shared interests and similar studies, similar programs of studies and campuses. So we'll have a conversation about that. We also have our online transition guide, which has information about over 190 colleges and universities across Canada. We've got information about accommodations and accessibility services, health insurance plans like we're going to talk about today, tips from our alumni about what to keep in mind when you are starting school with diabetes. So you can visit dhftransitionguide.com. You can scroll through it. It's got amazing information. So if you're still trying to decide where you want to go, or if you've already decided and you're ready to start the planning process, I would highly recommend you check it out. And we also have our free recipe guide, which is available online. So if you're getting ready to move out of your parents' home and want to learn some new recipes, or if you're staying at home and want to do some cooking to help your parents out, you can check out the recipes we have there. They have all the carb counts in it. They take into consideration celiac. They're all quick and easy, healthy recipes that you can make. And you also, if you'd like the hard copy, I like to have it on my counter and see it get a little bit messy as I cook. That's available as well through our website. You can follow us on Facebook, Instagram, LinkedIn, and then we also have our videos up on YouTube just to sort of stay abreast of what's going on at DHF and the programs that we have on offer. I'm going to stop the share now and get our guests to introduce ourselves. So we'll just kind of go in alphabetical order. Maybe Carol, if you wanted to start and introduce yourself, what school you're with and the role that you play there.
Sure. Hi, everybody. I'm a student union, and I was the health plan administrator until very recently. So I've been in this role since May 1st, but prior to that, I've been here for 25 years and have done the health plan since we've had it. So I know as much about the health plan as anyone here.
Oh, wow. That's amazing. Thank you, Carol. Oh, Ashley would be first in the alphabet. Sorry, Ashley. I was looking at the YFS president. Sorry about that.
Hi, all. My name is Ashley. My pronouns are he, him. I am the current president for the YFS. That's the York Federation of Students. We're the students union at York University. I I'm obviously the president this year, but last year I was the vice president of operations. And so I dealt pretty heavily with the health plan as that fell within my portfolio. The health plan is one of our most frequently asked questions, as with, I'm sure other folks might be able to relate to, like students always have questions about this. So every single executive for the YFS is pretty well versed with dealing with the health plan. But yeah, so I have a lot of experience with the kind of even like the back end stuff, but I not so much the administration side of it, because we do have full-time staff that kind of take care of that aspect. But yeah, I'm happy to share all that information today, or as much as I'm able to today, with you folks.
Wonderful, thank you. And Nethby, did you want to introduce yourself?
Hi everyone, my name's Nethmi. I just finished my second year in the Bachelor of Health Sciences programs at Queen's, and I'm excited to share my experiences like on the other side of the healthcare plan process as a student. And yeah.
And Nethmi is a 2021 scholarship recipient from the DHF program?
Yes.
All right.
Yeah.
So we'll just start with sort of more of a general overview of what's involved with the student health insurance plans. So I'm wondering maybe, Ashley, if you wanted to start us off with talking about how it's managed on campus, sort of who oversees the plan and sort of how to get in touch with them to find out that information.
Yeah, 100%. So for us at York, our student plan is managed by the student union, right? And that's very similar to a lot of the other student unions out in the GTA. A lot of us are federated with the Canadian Federation of Students, and so that is the National and Provincial Students Union. Through that, we're part of a network called the National Students Health Network, where we're able to then secure the plan for students through like Green Shield, which is the nonprofit, one of the only nonprofit student or just health insurance providers in Canada. And so through the National Student Health Network, we're able to kind of manage the plan for all students, right? And so everything kind of happens through the YFS offices. We have a full-time staff, like I mentioned, that is consistently busy because there's a lot of questions coming in about the health and dental plan, but they manage all the back end side of things. And then as the executives, we kind of, our role is kind of informing students, right, about the plan, how it works, and what's kind of included, what's kind of covered, and like, because that's usually a lot of the questions that students have. And if there's anything that's like further than that, more specifics, stuff to deal with their accounts and stuff like that, that's when it gets, they kind of reach out to our full-time staff. All the information for our health plan is pretty easily accessible. We try to make it very easy, and on our website, it is one of the most frequently viewed pages. If you don't mind, I can actually put the website within the chat. And that's our health plan website. And so there's a lot of information packed there, including how to opt in, how to opt out, the forms for that, which I'm sure we'll talk about later, as well as the entire like the package, right, with what's included within the plan. So the benefits plan. So there's a lot of information, and that's kind of the primary source and the location that we direct students to check out first, because we also have like a frequently answered questions section on there, which usually kind of covers any questions that students have. But that's kind of how stuff works here at York. We work not very closely with the administration on this, but they do provide us information about students, like student numbers and stuff like that, so we're able to verify like how many people are enrolled and what type of status they have, like are they a full-time student, part-time student type of thing, because that changes how the health plan is accessed. And we're the undergraduate students union, so we only cater to the undergrad students. The graduate students union on campus has their own separate health plan through the graduate students union, right? We have approximately 35,000 members on our health plan on a year-to-year basis, approximately, just because of the size of our school. We're a huge campus, and so we have a lot more students that are usually enrolled on a year-to-year basis. But yeah, that's everything I can think of right now for the YFS side of the health plan. But yeah.
Awesome, thank you. Carol, could you speak a little bit about how it's handled at Fanshawe? So if there's a difference between colleges and universities and how it's handled, and sort of fill in any of the differences between how York students can access healthcare or health insurance versus college students at Fanshawe?
Yeah, so the difference is we manage the plan ourselves. We're not affiliated with CFS at all. So the students at Fanshawe, it's on the website, the fsu.ca/health. Everything can be found there. Students can check out their different options. We have 3 different health plans. They can choose to be in a balanced plan, they can choose to be in an enhanced dental plan, or they can choose to do an enhanced drug or extended healthcare plan. All of them have different benefits. It just lets the student kind of have a bit more choice. The balanced plan, the flex plan option 1 is what everyone is automatically put into, and then students can have that choice to change out of it, to opt out of it, to add family members into it at an additional fee, etc. But the balanced plan has the most of everything, and our maximums are fairly high, and we try to do, we're 90% co-insurance or 100% coverage for dental and things like that. And the website has the claim forms, the videos on how to do it, etc. And then we have an office where our staff can assist any student that needs any help in learning about the health plan, how to use it, how to access it, etc. And then there's also a network of dentists and doctors and whatnot in the city that will provide a discount to the students. But then we have health services on campus as well that will direct bill, and we have a pharmacy on campus as well that will allow students to pick up prescriptions, and they will direct bill so students are not out of pocket.
Okay. Can I just ask about so you talked about the balance plan as sort of the go-to. What's the difference between the dental one or the one that's more focused on drugs and prescriptions?
Yeah, so if you went to the enhanced dental option, you would just get your maximum would be $800 instead of $600 when it came to dental, and your drug would go down to 80% copay instead of 90%. And then same with if you went to enhanced dental or enhanced drug, it's 100% covered up to $5,000, but your dental is down to $300. So it really depends on what the student's needs are. Like I said, though, the majority, and I'm talking like 98% of our students stay in the balanced plan because it's got the most of everything.
And is there a different price for each of the plans, or it's standard across?
Standard across, yeah.
And Nefmi, I don't know if you wanted to share if you've had any experience accessing the plan at Queen's, if it was through the Students' Union, and how you found that process, or any tips for making it easier for yourself and other students?
Yeah, for sure. So at Queen's, all students are automatically enrolled into a supplementary health insurance plan that gives like partial coverage for dental, travel, health, and vision. And so the supplementary health insurance plans are administered by Queen's Student Association. So for undergrad students, it's administered by the Alma Mater Society, which is like the big student government body at Queen's. And then for graduate students, it's the Society of Graduate and Professional Students. And there is a link that I can put into the chat about the one specifically for undergrad students, which is the one I've had experience with, that gives you like a full breakdown about what the coverage looks like, how much percentage of different services are covered, and then under each like sector, like vision, dental, travel, etc. And there's some other like hyperlinks about like opting out, how to claim, changing your coverage, the benefits of having coverage, and there's also like a little contact us page where you can call I think it's a 1-800 number or something like that, for any assistance or questions that you have. But yeah, I'm not on the administrative side, so I don't know like as much details about the plan, but it's pretty accessible and transparent to all students. Yeah.
And as someone who's kind of living with diabetes and needs those ongoing costs, do you find that it's pretty good at covering either pump or CGMs or supplies, needles, all that kind of stuff?
So I would say it's pretty good at covering insulin. In terms of CGMs, CGMs tend to be a little bit more pricey, I think. And if you have your own like insurance plan, you can opt out of the supplemental plan. If you don't, though, you have to go through with the supplemental plan. And who don't have an insurance plan, things like CGMs and even insulin can be costly when you have to get them on a regular basis. But yeah, I hope that answers your question.
Yeah, no, it does. Thank you. Turn over to you, Christian.
Yeah, so we'd also like to maybe ask you what the process is for filing the claims with the plan on your campus. That question would be more so for, I think, the representatives from the schools, and then Nethmi, we'll get to you afterwards, kind of your own personal one. But yeah, if you have anything to speak on that, feel free to go ahead.
For us, if you're on campus, it's pretty easy because you're using the on-campus pharmacy, and the on-campus pharmacy knows exactly what they're doing. So they can direct bill so that students aren't out of pocket right from September 1st. Now, if you're off campus, you have to have some information with you so that the pharmacy will know how to process the claim. But we have claim cards that we will give out to students when they pick up their student card or their bus pass, and they can print a card from the website. And a lot of the pharmacies close to our area do know the policy number, the group number, and then you just need to have your student number. So your student number is your PayDirect number, whichever student carries their student card with them at all times. So they can use that. And if the pharmacy cannot direct bill, the student would have to pay up front, and then they can sign in to through our website and create a profile and submit the claims online and have the payment submitted directly into their account, their bank account.
Thank you very much.
No problem.
Similar situation for us as well. We have two clinics. So we have just a regular clinic here and then a dental clinic on campus. So again, they're pretty familiar with the student plan, but we have all the information for how ours is set up on our website for students. And we also have a card that students can kind of download so that they have access to it. For us, the way that their plan number is, it's YFS, their student number, and then 00. So kind of like a similar system, like how Carol was mentioning at Fanshawe as well. For when students usually ask us this question, what we tell them is that it really depends on your practitioner, and right. So if they kind of are able to process claims automatically from their end, it's super chill. You don't have to worry about anything, right? And then you just pay whatever's left over. Sometimes when they don't, the practitioner doesn't file the claims themselves. In that case, again, similar to what Carol mentioned, students would just need to pay up front, and then they can submit the claim through the portal online through the Green Shield account. So when we tell students about the plan, one thing that we always recommend is go set up your Green Shield account, so that way you're able to access that, right? So they kind of are already aware, and then our staff can also kind of help them with that, creating that account. Once they have that account, they can kind of submit those receipts and get those claims, and then again, it will just go straight to their bank account, as they can kind of submit that direct deposit information and stuff like that through that Green Shield account. But yeah.
Oh, thank you very much for the information. And Ethmi, along those lines, can you maybe tell us what your experience has been like?
Sure, yeah. I'm not sure the details of how to submit a claim exactly, but in my experience, at least with the pharmacies close to campus, every time you go, they ask you if you're on a student plan, and obviously, if you opt out of the student plan with the AMS at Queens, you would go through your own insurance plan. But if you're with the student plan, you just give them your student number, and then whatever gets covered, and then I would pay the rest. But that's only with my experience in Kingston pharmacies. I'm not sure how it would work like outside of Kingston, but for the most part, it's pretty easy and straightforward.
Great, thank you.
Yeah, sorry, we just had a question in the chat, and I know Carol, you answered it, but I just want to get it recorded for anyone who's not here with us live today. If you're under your parents' insurance, do the claims go through the school first, or do you go through your parents' insurance first, and how does that manage with balancing the two plans for coverage? And I'll throw that to Carol or Ashley.
So I use the word supposed to. because it doesn't always happen that way. And nothing will happen unless the insurance company catches it and says, well, you're first, because the student has direct insurance through the student health plan unless they have opted out. And so they are supposed to claim through their insurance company first and then coordinate it with any other insurance companies they have. But that doesn't always happen because students, they won't know they have a student plan, or they won't know how the procedure works. And the parents are so used to just putting it through their plan. So, you could get into a situation where insurance is like, what are you doing? You're supposed to do it this way. And they'll fight that out. But the proper procedure is for the student to use their plan first and then coordinate.
Same process on our end. Whenever there is a student plan active, essentially that becomes their primary plan, and their parents' plan, or the plan that they would be on through their parents, would act as their secondary plan. So if they have multiple plans at the same time, they have to submit through their Green Shield account first, and then they can. And so we often encourage students, especially that miss the opt-out deadline and stuff like that. We're like, hey, why not combine your plans, because then you can get both those things. However, some students choose to do it, some students don't. But if they do choose to do it, we just let them know that the student account is their primary, so they have to go that one first, and then their family one second to get the maximum coverage.
Okay. And I just had another follow-up question. So you've talked about pharmacies on campus and near the schools. For people who want to keep their pharmacy at home, like if they're going out of town and they want to keep their prescriptions with their home pharmacy, is there any issue sort of accessing the student plans? Like if I'm going to Queens, but I want to keep my Toronto pharmacy, or is that still pretty smooth process?
Yeah, on our end, there's no issue at all. Because it is a Canada-wide plan, it's in fact coast to coast. As long as you provide the policy number and it is and the plan number and stuff like that, you're pretty much okay to use it wherever. When I was a student and I was on the student plan, I used to live in Milton, so I used it in my pharmacy in Milton. Used it on near campus, so it doesn't really matter where you use it as long as you give them the information that they require. Obviously, when you kind of go further away from campus, the pharmacy and stuff won't have as much knowledge about the plan. So making sure that you're being clear about, hey, this is this information, this is what the plan number looks like, is always helpful. And so we have all of that stuff uploaded to our website, so students are able to kind of download that to make it easier. But that's just the natural issue that always pops up because they wouldn't have that context, right? So it kind of falls on the student to kind of explain the numbers and stuff clearly. But other than that, it's very much usable everywhere.
Okay, perfect. And I just want to sort of clarify for my own head. So when you're making claims, it's usually the campus that you're going through, and you're sort of not dealing directly with Green Shield or Sun Life or whoever it is for making the claims, or did I misunderstand that?
On our end, it's Green Shield. So we don't actually manage any of the claims that come in. We just manage the administrative side of getting students opted in. Everything else related to the claim, students getting their money and stuff, all goes through Green Shield. And so we kind of are just helping process the administrative side of things. Yeah.
And same for us. Ours is Claim Secure, but we can help process all of that if students have questions and need help. But Claim Secure is the drug company that will do the actual payout of the refunds.
And if there are any issues, is there support to sort of self-advocate or help advocate for any challenges that come up when things aren't lining up with what's on the website and what the agent that you're talking to is telling you? And how do students access that advocacy support?
On our end, you can on our website, it has the email for our health and dental coordinator. So students are welcome to book a phone call or a in-person visit to kind of ask more questions or something like that. If there are kind of inconsistencies or if there's any confusion really about any aspect of the plan, we have the main coordinator as well as part-time staff that are able to answer questions that are more easy to answer. So we do have a pretty solid support system in there in process to kind of help answer students' questions.
And we also, so our website has a chat feature, so you can type in a chat, and also the health insurance company itself has that chat feature as well. The 1-800 number, you can come to the office. We're open every day. You can email us. Same thing. There's lots of support options for those students.
Okay, thank you. And the next sort of formal question, for diabetes supplies and tech, and this may be a question that needs to go to the plan itself. Is there anything students need to get from their doctors ahead of being able to file claims or get coverage with the two companies that you're working with?
So on our end, for a lot of the things, like you need a prescription, and I can kind of break it down. Full context, like I don't know all the details with the specific regards to diabetes, but I have tried to pull as much information that I can to help out. So if there are further questions, I might not be able to answer all of them right now, but I can note them down and then talk to our contacts at Green Shield to, get more specific answers. But based on what I've been able to figure out is that, so through our plan, there's a $500 coverage for any sort of diabetic equipment coverage, right? So that's the blood glucose monitors, Lancets, or the glucose monitoring systems, right? Now, all of these ones are, like, they need to be prescribed, right, by a qualified medical practitioner, unless there's like a specification for otherwise. Yeah, and so there's usually, like, you'll get reimbursement for all of the any, like, reasonable and customary charges, and like it'll be up to $500 for any given year, just for the equipment side of things, right? You can also get coverage through our, because the prescription drugs coverage is $1,000 max per person at York, and so this covers like 90% of any sort of prescriptions or refills, right? Again, these need to be like prescribed by a practitioner, but there are like some like exclusions, right? So for example, like stuff like insulin and other injectables that don't require a prescription, they're like, you don't need to provide that prescription to get it covered, type of thing. So even related supplies such as like diabetic syringes and needles and stuff like that, you don't need to provide a prescription for that to be able to get the claim through the insurance. You can just, when you're purchasing, you can let them know, and it should go through. So the exclusion is that through our plan, reimbursements cannot be made for insulin pumps and supplies. So that's the only thing that it says on our benefits page that you're not able to get the claim for. But other than that, like, there's like a pretty solid level of like coverage. And in the most case, what I would like recommend is, like, if you have a prescription, like it always is helpful, right? In any specific situations where you're not sure, that's where you can always reach out to like our Director of Health and Dental Services, so that they can like kind of clarify that for you, or to the Green Shield like themselves, right? But yeah, hopefully that answered the question. But if not, let me know.
Yeah, for sure. Thank you. Carol, did you have anything different?
Yeah, there are maximums when it comes to insulin supplies, and it's fairly clearly written under the policy so that students will know upfront. For us, it's $1,500 a year for the maximums. So, and there's a 90-day supply limit for prescription. But for stuff, if there's specifics that the doctor has to do, I wouldn't be aware of that, other than what Ashley had said with the prescriptions, right? Make sure you have your prescription ahead of time. But we also have a doctor on campus if there's something that needed to be added after the fact. They can set up an appointment and go to the doctor too.
Okay, perfect. Thank you. Nethmi, how have you found the sort of what's been covered in making the claims for your supplies? And sorry, I'm going back a question because I looked too high. But is there anything that you needed to do? Because I know, like, I just started with a new insurance company and I had to get a formal letter from my doctor saying that I was insulin dependent and all this kind of stuff despite the prescriptions. So I'm just curious if there's anything that you encountered when you started with Queen's.
So in my experience, when I initially set up the plan at a pharmacy, all I needed was a prescription. And I pulled up some information here that says that our health plan will cover eligible prescription drug costs and vaccinations up to 80%, up to $5,000 per person per benefit year. And so it's like there's like a list of medications listed in I probably found in like an FAQ section or something like that, but insulin and diabetic supplies are mostly covered. And I didn't need I didn't need a form filled out by my doctor or anything. I just needed a prescription. So it was pretty easy to access for me.
So we are aware that there is something known as like a blackout period. And so we kind of maybe want to learn a little bit more about that and how these can impact access to prescriptions.
Sorry.
Yeah. I was going to say, maybe we can start with Ashley.
Yeah. So for us, our blackout period goes from 1st of September all the way till October 14 or so. And for more context on what the blackout period is, it essentially allows students the time to kind of opt in, opt out, and for Green Shield to make sure that everybody's kind of registered into the plan and give that time, right? However, it doesn't mean that students can't use their insurance at that time. The only thing is that they wouldn't be able to go to the pharmacy and get those claims done automatically. They'd need to pay out of pocket, but then they can still get reimbursed any purchases made on or after September 1st, right? The way our plan works is September 1st to August 31st of every year. And so anything done after September 1st, they're able to get a claim, right? They just have to go through the website, right? And submit that. And so we just encourage students to keep their receipts and stuff like that so that they can get the claims through the website. But other than that, there's no other limitations, only being that you can't use it in person. Sometimes there are also like features of the website or like the account that won't work properly because of the blackout period, but it doesn't change any sort of coverage that a student receives, right? You get it like later, then you just have to pay up front. That's the only difference. The way we have it is that there are 2 blackout periods, but your blackout period is for when you start your classes. So say you start your classes in September, you are in the fall blackout period, so you have to wait till October 14th, and then you get coverage for the rest of the year, no issues, right? However, there is a winter blackout period, but that's for students that start in the winter semester. You won't get affected by that if you're a student that started in the fall, right? And so once you kind of only have to deal with one blackout period throughout the year. And so the second one really doesn't affect you, but I know that is a question that usually comes up. But yeah.
So we don't have a blackout period at Fanshawe. So for the fall anyways, we upload all the students that have paid at the end of August so that they have access starting right from September 1st. We do still have the opt-out period for those students that are wishing to opt out. That starts in August and it ends after the 10th day of classes, which is the same timeline as if you're to withdraw from school and get a refund, it's the same 10-day deadline. So we kind of coincide it with that. So students can go September 1st and get their prescriptions filled as long as they have paid their fees. Now, there is that if they haven't paid and they aren't fully registered, they won't be on the system yet. But we try to get as many students up and running as of September 1st as possible. It's a different story when we have students starting in January and in May. There is a bit of a wait because we're just checking for new ads at that point. So we're not sending different enrollment files all over the place. So there's a little bit of a difference there.
So if they haven't paid their fees, like if they're late paying their fees, does the insurance coverage start when their fees get paid, or are they able to go back to when they should have been paid and that's when the coverage would start?
Yeah, the coverage never changes. The coverage is always September 1st to August 31st, as long as they pay at some point.
Okay. Ashley, I saw your hand up. Did you have something you wanted to?
Yeah, I wanted to just add something, but in our case as well, doesn't matter with the fees, like same situation. You get it on September 1st, regardless of whether your fees are paid or not. But like the expectation is you pay that off at some point because it will be on your account, right? What I did want to add is about students that are opting in. Right? Because in our situation, the automatic opt-ins are not for every single student on campus. It's for full-time students. So in our case, it's 15 or more credits per semester or per year. Sorry. We're also different because we do like 3 credits per course. So don't get too thick with the numbers. But essentially it's like in our scale, it's 15 credits per year. If you are under that, you're considered a part-time student and you don't get automatically opted in, right? So say for any reason you're taking a lesser course load, right? You need to make sure to opt in, but usually what happens is the blackout period and the opt-in and out deadlines are the same time. So our blackout period ends on October 14th, but that's also the opt-in, opt-out period ending, right? So if you want to opt in, if you're like a part-time student or something, you need to do it within that blackout period as well, right? But once you do it, you still have access to the plan even before September 1st, right? Or up until September 1st, even if you opted in, say like October 1st, it doesn't matter. You'd be a part of the plan and you could still get that coverage. So there's one note that I wanted to make because I'm sure there would be some students that might not end up taking that full course load, right? And it might affect them. So yeah.
And I guess, Nethmi, have you noticed any hiccups with the blackout period at Queen's, or has it impacted you at all in sort of accessing your medications?
So Queens has two blackout periods. There's a fall blackout period from like about September 1 to October 31st, and it's about 2 months. The winter blackout period is for like students that start their studies in January, and it also lasts about 2 months from January 1 to February 28th. But the students who are already enrolled in the fall are not affected by the winter blackout period, but there are two. In my experience, I usually get like for me, insulin vials are the main concern, and I usually get 3 vials at a time. So that lasts me for about 2 months. So I usually like plan in advance and make sure that the blackout period isn't an issue. So I would really suggest like structuring when you're going to get your prescriptions, and like what days you plan on going to the pharmacy. But yeah, overall, it's doable, as long as you like work ahead.
And then we had a question in the chat, and it's also the last question that we have for you today, is about opting out. How that works, how you opt in, if there's what the cost associated with that is. And we've already talked a little bit about combining with family plans, but I know, Carol, you had mentioned being able to add members to your plan. So if you can just sort of touch on the opting out process, opting in, and sort of adding people to your plan.
Yeah, for sure. So students have the opportunity to opt out if they have similar coverage. So we want our students to be healthy while they're at campus, so we want them to have some sort of plan. So if they have similar coverage, they can sign onto our website and fill out a form. It's very straightforward. Who you are, student number, what your coverage is, and that you're choosing to opt out. We keep all of our students in our AD&D, which is our accidental death and dismemberment portion of the plan. In case there is a tragic accident or whatnot, they still have that coverage as well. Once they filled out that information, we check to make sure that they're full-time students, they've paid the health plan fee, et cetera, and then they are refunded, and they opt out amount, which goes directly into their bank account through a direct deposit, minus that AD&D portion of the fee. And we do it in September for the fall students, January for the winter students, May for the summer students. It's direct deposit straight into the account. We're good to go. Now, if they choose to add family members, so dependents, they can do the same thing. It's on our website through an online form, and they can purchase that. There's 3 different rates: a fall rate, a winter rate, and a summer rate. The only stipulation is you have to do it your first semester. So you have to do it in September. If you're here in September, you can't pay a lesser fee and go in January and say, I only want the coverage from January on. So that's one stipulation that we, some families don't understand right off the bat, but they do it the first semester that they are here on campus. The amounts, it varies. Right now, a student coming to as a full-time student paying is $230 for them for the year for insurance, for all of our insurance. But if they were to add family members, the rate for the fall was $665. And that is only because, if somebody is opting a family in, they're using the plan, and we don't want our other students subsidizing that family member using it. So the amount, and it's unlimited dependence, right? So you can opt in 5 kids if you wanted, and your husband, and have full use out of that with, $5,000 maximums in drugs and $600 in dental and $250 in eyewear and whatnot. So That's why it seems like it's so high, but it's 12 months worth of coverage, right?
I am going to attach a link. It has how, like, our website on how we kind of opt out. Process, again, is similar. Like, you need to have some sort of comparable insurance, right? And show proof of that. And once you do that, then you're able to opt out for the same reasons that Carol kind of mentioned earlier. A lot of students do choose to opt out, right? But there are so many students that are like international and stuff. We have a massive like international population. So a lot of students end up staking on. And like Carol was saying, like the plan is actually like really like cost effective when you think about it, right? Because it's like a one-time payment, but then you get like 12-month coverage, which is incredible. In our plan, I can send y'all the rate breakdown. Our basic plan, so a full-time student, but just a single plan, is $270 on the plan, and that's the second link that I just sent. You can add dependents as well as add family members, right? If you're doing a couple, all you have to know is that on our plan, it's like $270 is the baseline amount. So anything you add is like added to $270. So $270 for a single person, couple would be $270 plus $267. It's a little bit cheaper, and that's the total amount that you pay. When students opt in or opt out, that amount goes to their student account through York. So we don't actually have, like, nothing gets sent to students' bank accounts, but it kind of gets sent to the intermediary, like York student account statement. And that's where they see the charge, like plus $270 YFS health plan or minus $270 opt-out YFS health and dental plan type of thing. And so people that want to opt out, they just see it through there, because the way it works at York is students pay to the York bank account through their account, and it's a weird system. So that's how it kind of works on our end. So students will just see it on their on that end. They don't get any money back or anything like that. There are specific situations where students have paid their full amount, not realizing that the plan was included in that tuition amount for the year. In those cases, when they opt out, then we will either transfer them money to their bank account in special scenarios, but oftentimes that credit would remain in their York account for the year, and then like say they're adding or dropping another class, it just gets canceled out. So they still get their money back, but depending on the situation, things can look a little bit different. So the opt-in process, again, pretty similar. There is usually a button on our page. Right now it is taken out because we are not accepting any opt-ins and stuff right now. But similar process, you go onto our website and you just click in there's a form. It'll ask for some personal information and stuff like that. So we're able to kind of figure that out. If you want to add any dependents and stuff like that, you can figure all that stuff out. And then once that's done, we say it's usually like a 2 to 4 week turnaround time. But again, once you're opted in, you have coverage all the way from September 1st, which is always nice. The one thing I will mention is that when we were talking about like the blackout period and like the opt-in, opt-out windows, the way it works at the YFS is that you also need to if you have a dependent or family that you want to upgrade that coverage, you have to do it within that time frame. Right? If you miss that window, then you can't add like a dependent afterwards. So as long as folks are able to add it like mid-October, they're good, right? But they have to kind of make that change at that point. There are a few other reasons why students might need to opt in. So I mentioned the part-time student, if they don't have those credits, they won't get automatically, so they can kind of put that in. Any students that are registered for any sort of disability through York, they can opt in. They won't get automatically opted in, but they opt in because they won't take when you're enrolled in the disability thing at York, you won't take a full course load, right? So you won't get automatically opted in, so they would need to manually opt in. But when they manually opt in, we actually provide them with the full-time amount, right? Because they are registered with the Student Disability Services, and so they still get full-time coverage, but because they just taking a lower course load. The other circumstance where students would need to opt in is students that are graduating, right? So say I'm graduating, I only need to take 2 courses. that wouldn't make me a full-time student. However, if I'm like provide proof that I am graduating, then I can get the full-time rate. So those are the couple other circumstances where things might be different that might be helpful for folks to know. Yeah.
And just to clarify, for when you want to bring other family members in, it needs to be partners or dependents. Like you can't bring great grandmas and aunts and uncles and
Yeah,
siblings.
so it's partner or like children or something like that, right? You can't go like your parents that need like help. Like it doesn't unfortunately work. So it needs to only be partners or below. Yeah.
Okay.
We also have an age limit on ours. We found that out the hard way. But yes, dependents only, partners and dependents.
Okay, perfect. Nethmi, have you had any experience with the opting? I'm assuming you haven't opted out because it sounds like you accessed the plan, but just anything you need to add from the other side of things?
Yeah, it's really similar to what's already been covered. If you have like your own plan outside of basic provincial coverage or UHIP, you can upload like a proof of that and then opt out. And opting out is fairly like easy and quick. It's like, again, there's like a specific time frame, and then there's some information that you have to fill out with like your student number and things like that. And then you just click a few buttons and then you're able to opt out provided that you provide proof of coverage. But yeah, making sure that you get it done within that time frame because it can't be done outside of the time frame.
We'll take the time to plug again our transition app, which is completely free. You can go online, you can go put in the college or university that you're planning to attend. It'll tell you what the health plan is. It should have a link to the student union page if they're the ones who manage the plans. So you can go in and check out what's available and start doing that research now so there aren't any surprises when you get there in September. There's going to be enough kind of coming at you September 1st or whatever day your classes or your orientation week starts. So it's kind of nice to get this stuff researched and done out of the way.
I can do a shameless plug for all the student associations. Even if you don't want to talk about the health plan, go to your student association offices and get involved with the student association, volunteering, working. We have lots of jobs on campus, any of the events that we're doing, any of the advocacies that we're doing, all across Canada. I actually am a board member for student associations across the country. We're all here to do the same thing. We're all here to support the students and be here for the students and better the students' lives while they're at our campus. So, you know, get involved with them as soon as you can. And if you just want to go and introduce yourself and ask a couple questions, they'll be happy to see you.
Yeah. One thing about university and college a little bit different than high school is there's sort of this network of support built into them to make sure that you have what you need, can navigate the systems that you're navigating. So take advantage of it, make those connections early. Even if all you ever do is say hi, at least you have them and you know where they are, you know where the office is, you know the website. So thank you for that, Carol. That's really important to pass on. So I guess I will just sort of say a thank you to Ashley and Carol and Nethmi for taking the time this afternoon. I really appreciate you sharing the information. We will be putting it up on YouTube for anyone who missed it, because there's a lot of great stuff in here. And I'll be sending it out to everyone as well via email. So if you weren't taking notes because you're so enthralled with everything that's being said, you can watch it again. And then we're kind of also working on putting this together in a downloadable documents so people can get it that way as well. So thank you very much. We really appreciate your time today, and I hope everyone enjoys the rest of their evenings.
Thanks for having me.
Thanks for having me.
Thanks, y'all. It was a pleasure to do this. Take care.
Have a great day.
Take
Bye.
care.